Hi, everybody. Happy Sunday. Last week, gave you a little pearl on communication and how to, one of the little secrets that I have. This time, I have somebody from LinkedIn who reached out to me, a professional who talks about this and is putting together a TEDx talk. And she wrote this article called "Seeking to Understand Differences Can Improve Patient Experiences." My name is Dr. Elsie Coe. I'm the founder and CEO of Lead Physician on Leadership Program for physicians and the chief medical officer of American Endovascular and Amputation Prevention. If you want to hear that pearl that I gave you, go to YouTube and subscribe, and so you can listen to it. Today, I'm talking with Jess Daigle, and what I like to do is show you who she is on LinkedIn. She shows herself like this. Okay, she's a board certified pediatrician, a neonatal intensive care unit and pediatric hospitalist, also the founder and CEO of Mom and Me MD. Okay, this is a personalized care for people in their after giving birth. So women leaving, having given birth and going home, making that transition can be really, really hard. And so she's created this platform to allow virtual and personalized care for newborn and postpartum care. I think that's brilliant. Here's the blog post that she put together. And if you go to the blog.pediatric.com, you can read it. Seeking to understand differences can improve patient experiences. And it's just a perfect transition to what I was speaking about last week. So let me bring her on here. Jess, thank you so much for being here.
Thank you. Thank you so much for having me.
Yeah. So you love talking about not just mom and babies, but you love talking about this topic on implicit bias.
Yeah.
Can you tell us a little bit about what implicit bias is to begin with?
Yeah. So there's a lot of different definitions, but it's typically a form of bias that occurs when you automatically, unintentionally make decisions based off of preconceived stereotypes. And is really like you're unconscious. So you're making a decision based on what I think I call the three E's: your exposure, your experience, and your education. So all of these three things kind of make up who we are. And so we formulate every day a lot of decisions about other people and situations based off of these things. And it becomes unconscious because all of those things have kind of become a part of us. And so we're just kind of operating in this world, moving in this world, and you come across a situation and you automatically have a decision. And so that's why in that article, when I wrote it, I was really trying to point out that in every situation you kind of just have to be aware of the fact of what you think about yourself when you're going in to take care of a patient per se. And as physicians, we know we see a lot of patients in a lot of situations, and we do have to lean on things like typical risk factors or who's most likely to do things like, say, a mom who comes in with no prenatal care. Well, we are going to be wondering, why wouldn't she want to have gotten care? So is she someone who has, say, done drugs or has risky behavior? And so in a way, you need to understand that because it is likely, but you can't just only lean on that. You have to be willing to be open-minded that, well, there's some other reasons that she didn't get prenatal care other than the common things that we've been taught. So that's kind of what I think
Yep.
about how implicit bias can impact us as physicians. So it's not that it's abnormal, it's how do we deal with this normal part of our character so it doesn't stop us from doing our best by patients.
I love that, and I can't wait to hear your TEDx talk when you when you do that. Take us through the 3 steps. You formulate 3 steps, communicating better with our patients.
Yes. So I think like ACH. So, you think about the bank, you think about ACH, just how you transfer like money or whatever. So I kind of thought that this is a way that we can transfer or transform even like our care. And so the A is awareness, the C is curiosity, and the H is humanism. So first is awareness. Like I've been on this like self-aware journey. I think so much we always are looking external to ourselves instead of thinking and like, who are we as a person and what has impacted us, even from our upbringing. Like, why do we make the decisions we make or think the things we think? And so sometimes it takes just sitting with yourself. So one of my practices when I get home from work is I actually take time to reflect on the day. Like all the patients I came across, if there was a situation, I always think, did I handle that situation properly? Did I do my best to communicate to that mom what I thought was going on with her baby? Did I take time to see if she actually understood the plan or what we were going to do? So if we're aware first of ourselves And like, okay, yeah, I did when I walked in that room to that mom who was on meth. I kind of was a little bit like, why are you doing this to your baby, or, whatever, right? Because I mean, that's fair, that's valid. We know that drugs just harms the mom and the baby, but then it's just taking that other step. And so our impressions, our upbringing, and viewpoints all contribute to bias. And so it's not saying, oh, I'm not biased or I'm not judgmental. That's not true. Nobody can't say that. But what you can
Right.
say is, okay, I did feel a little type of way, but I'm not going to allow that to stop me. I'm going to take the next step. And the next step is to curiosity. So asking yourself and the patient why and what. So why do I feel this way about this person? Is it justified? Like, yes, I don't want her to do drugs because I care about her and her baby.
Yeah.
But what has happened in her life, in her circumstances, that has led her to this moment? Because each of us have been through things that we could have probably taken a different path, but we chose not to. I grew up in a pretty rough environment, and I like to say that my church community and education, the fact that I was really smart when I was younger, and my mom honed in on that, I think that shaped me. I could have very well ended up like other people, doing drugs, having children when I was younger, things like that. I think about that for myself. And so that a curiosity a lot of times allows you to open up discussion with someone and learn a little bit about them. And
Right.
then you can ask yourself, well, how can I help them inside of this? We all have this backstory. And if we seek it out, which is what I mentioned in the article, it lends to perspective and understanding. Like that young teenager who looked kind of standoffish. Well, it turns out she had this thing going on. She was really scared. If we look at it, a lot of things are often out of fear, right? Like,
Right.
often afraid when we don't know something, in fear, then we tend to lash at the thing we don't understand. And so that's human. So again, it's human, but how do we not let that stop us from being our better self? And so
Right.
again, the human is the H, humanism. So we all have made poor decisions. We all have allowed our past to shape us in some way, good or bad, and it impacts us.
Yeah.
And so we remember that about ourselves as people,
Mhm.
that we take time to say, you know what, I probably lashed out at a colleague earlier today, or was short with my boss or with my husband or my child. Then if people were to rush to judge us for that, like, oh, you're a bad mom because you snapped at your child, then we will all never have any grace. So the humanism allows us to extend grace towards others because we all need that same grace. And even if we haven't been there, so I've never done drugs, but I can understand how a situation can make people want to, but I've grieved, let's say. So
Mhm.
I see how a loss, I chose maybe prayer and journaling, whereas this other person turned towards, they may have been in a bad crowd and someone's like, hey, come smoke this to relieve yourself of that pain. We're both trying to do the same thing. We're both trying to relieve our pain, our frustration, our fears, but I chose this path and they chose that one. So
Right.
awareness,
Mhm.
curiosity, and humanism, those three things together, I think will go a long ways towards helping us to communicate better with our patients and then helping them to get better outcomes.
I love that. Thank you so much. And you know what? In your article, you spoke about different incidences, two different situations where you were able to kind of understand someone from a completely different cultural background. Can you
Yeah.
talk about one of them? I know one of them was with an Indian family, and they ended
Yes.
up bringing
Cooking
you
me
a
some
butter
food.
chicken at the end.
Yeah. Yeah, so I had this family, this Indian family. The baby was in the NICU, and the dad was kind of like, I don't want to use the word hovering, but he was present. Okay, he was there, and when the mom was trying to breastfeed, he was in there trying to get in there, and the nurses were also trying to get in there and trying to help the mom breastfeed. And I sensed the frustration. One, I heard the frustration more on the back end, right? Like when the dad leaves, the nurses were like, oh, we're just trying to get this done, and things like that. And I understood it from both sides, because I understood that they were trying to do their job, but then this dad is trying to be the father figure, the male figure in that culture, which is what they're like. And so I actually sat down to ask him. I said, hey, what is your role in your culture, as an
Mhm.
Indian man with your wife breastfeeding? It's, talk
Mhm.
a little bit about that.
First of all, I just want to say that was the awareness and then the curiosity, asking the
Yes,
question.
because
Okay.
I didn't choose to think. I think you have to have a little bit of a belief that most people are trying to do what they know is best, right? And it's
Right.
until you learn something else that you do something else. And so
Exactly.
he's trying to do what is normal to him, but I'm not Indian and neither were my nurses. So we were going to have a different viewpoint. We just only had our perspective. So by learning that, hey, he's just thinking he's trying to be supportive of his wife, then I was able to say, hey, the nurses are also trying to help do this. Maybe if you stand to here, then they can sit here. We can actually put a chair here so you can still be involved, but that way they can get in where you're standing because they need to be able to position themselves to help the baby latch and things. And then it was like pretty good after that. And so then when he was in charge, he cooked me up some homemade butter chicken. He was like, I made this for you. It was like,
That is
but
so good. I mean,
yeah,
just a
well,
little piece of just amazing, like a small bit of communication and stepping back and asking questions, you can
I
have the
see it time
result.
after time,
Yeah.
Dr. Cole, time after time. I have so many examples, and that's
Yeah.
why I know it works because
Mhm.
this is what I live out. And I say that that's why I'm honest. Like you do have the bias, you do have frustrations, you are frustrated with your patients when they don't do
Yeah.
the things. That's
Yeah.
true because you are coming from a good place. Just like if your kid,
Mhm.
you're telling your kid to do something that you know is not going to harm them, they want to do their own thing. You're frustrated, like
Right.
like I love you, and
Right.
you're not listening to me.
Absolutely. I mean, I used to have staff members and myself, we used to get really frustrated when a patient came in and was, very difficult and angry, and would take it personally. But
Yeah.
then, if you step back and again, the awareness piece of, okay, what's going on here? The curiosity, why are you this way? What's going on? Can you tell me a little bit, and you find out that, these people are sick. These
Yeah.
people are depressed. And
Yeah.
and if you see it from that vantage point, there's a lot more forgiveness, and then you can go ahead
Yes.
and do what you need to do. So,
Yes. Most people are just trying to survive. Like it's real. Like and most of the time, unfortunately, by the time our patients have gotten to us in most cases, they're already at their wits' end, right? Like most people aren't at the preventative stage of things.
mhm,
They're at the like I'm near death or I'm at the end of my rope. And so you're already just mentally and emotionally in a different place. And
yep.
so, part of that the problem is we don't really have the time. So I know a lot of my colleagues will be like, I hear all that sounds good, Dr. Daigle, but I don't really have the time to do it. And you would be amazed that spending a little bit more time, maybe 5 or 10 minutes up front, can actually save you some time on the back end.
Yeah, absolutely. You're not spinning your wheels and
Yeah,
getting frustrated.
yeah,
Yeah, so thank you so much for this. This was a great segue to from the last, podcast. I really appreciate it. And,
yeah,
I can see, how you are an excellent, at what you do with the mom and me. I just wanna show some of your personal information, if that's okay. People reach
yeah.
out to your email. Here's your email, Dr. Jess Daigle, MD at gmail.com. And she has a, sign up if you're interested in that fourth trimester of care. If you know somebody who needs that, wow, what a person to do that. momandmemd.com/sign up. And you're also on Instagram, right?
Yes, yep.
Instagram at mom and me underscore MD. So
Mhm.
thank you everybody for listening. My name is Dr. Elsie Coe. If you have a topic on physician leadership, please reach out to me. And also, if you have any topics that you would like to hear, let me know. Go to leadphysician.org if you're interested in leadership training yourself. Any last words for us, Jess, as we close?
I think the biggest thing is just understanding that like we're all in the trenches together as patients, as doctors, as healthcare team. We're all kind of like a victim of this system of trying to make it and provide good care and be healthy and well. And I think if I would say the first thing to do is just start with awareness. Just take some time and say, who am I as a person and what kind of doctor I want to be. That was one of the biggest things that I think that informed and has influenced the type of doctor I am. So when I was in training, I paid attention to my attendings. And I was like,
Mm,
I really like the way that person was able to calm that person down or really
mm,
get to the root of the problem or like reassure that mom or that validate. Really validation is so important. And so even if you just start with even validating too, like, you know what, I understand that this is difficult. Sometimes just acknowledging
mm.
person is struggling will buy them into, you know what, they're not just in here just to rush me through. They really see me as a person. And I think all of us want to be seen, like regardless of
Yes.
who we are. So
Understood and seen. Yep.
That's
Thank
what
you
I would.
so much. Thank you, everyone. Happy Sunday. Stay on, Jess, so I can say goodbye.